And we can say you can show your appreciation as well by posting messages of support on social media with the Doctors Day hashtag. But not only is it Doctors Day, it's also First Responders Day. So on behalf of all Londoners, I'd like to salute our police, our fire, our EMS personnel, and all our frontline staff for all that you do. You not only keep us safe, you make us proud beyond measure. Now, I'd like to offer the London Challenge. The best way Londoners can pay tribute to our first responders, our doctors, and all frontline essential workers is to continue to follow the same guidelines we've been following the last month and a half. Look, I know it's repetitive, I know it's tiresome, I know it's difficult, but it's nowhere near as difficult as what we ask our frontline workers to do on our behalf on a daily basis. Physical distancing, hand washing, avoiding non-essential travel, keeping to no more than 5 people together. These things don't just protect you, they protect the long-term care worker, the retirement home worker, they protect our health workers and our frontline staff. They protect our first responders. So on this Nationals Day and National Doctors Day and First Responders Day, as they keep us safe, all of us need to do our part to keep them safe. So even with this beautiful weekend weather in the forecast, let's think of them when we might be tempted to make a personal and selfish choice. Instead, let's continue doing the right thing. And as hard as that might be to do, it is my challenge to Londoners. And in my opinion, is the best way we can truly pay tribute to those selfless men, women, and their families on National Doctors Day and First Responders Day. Over to you, Dr. Mackie.
Well, thank you very much, Mr. Mayor, and for your kind words of support. Those comments really do make a difference to people on the front line. Things have continued to move in a positive direction from the perspective of our epidemiology around cases of coronavirus. 7 cases in the Middlesex and London region over the last 24 hours, 6 of those in long-term care or retirement homes. Provincially, 429 cases. That continues a downward trend that has now been in place for about a week's time. The provincial data around healthcare is mixed still. We are seeing less use of intensive care units and ventilators, whereas there are more patients in hospital overall with coronavirus. So that likely is because we have more diagnostic capacity now and are able to offer testing to a wider range of folks. Continuing to work very hard to test all of the long-term care homes in our region. We are 50% through long-term care homes as of end of day yesterday, with more being tested today, tomorrow, and Sunday. That testing will continue out for another week and a half or so, at which point we'll have tested all residents and staff in long-term care homes in the region, as well as in any other sort of congregate settings where there have been cases identified. I'm pause there, Dan. Happy to take any questions.
All right. Thank you both very much for your words to get us kicked off today. We do have a couple of questions in the queue, so we'll get to those right away. First one, Dr. Mackie, is for you. It's from Dan Brown at the London Free Press. Is community transmission of COVID-19 low in London and Middlesex? And are retirement homes and long-term care homes the biggest contributor to the new case numbers in London and Middlesex?
Well, at a very simple level, the answer is yes to both of those questions in terms of the number of diagnosed cases. 6 of our 7 diagnosed cases, for example, in the last 24 hours, I believe it was 7 out of 9 yesterday, are all from retirement homes or long-term care homes. That means just sort of 1 to 2 cases a day recently have been identified in the general public, and that's in spite of having about 150, 160 tests done each day in the assessment centers and probably another 200 tests done in hospitals on top of the testing we're doing in long-term care homes and retirement homes. So the percent positivity in our community is very, very low. In other words, if you have symptoms in this region, the chances are less than 1% that you would test positive for coronavirus. That said, we do have limited testing still, and there hasn't been any real survey data done to capture what is happening across the whole population. The other thing that I would note is that coronavirus is getting into long-term care homes and retirement homes because it is still present in the community. And so it's not at all time to start relaxing the restrictions in the community, because if we do see those rates climb up again, then we know the disease will get into those long-term care homes and retirement homes and make our vulnerable citizens place them at greater risk. So absolutely, as the mayor indicated, we need to continue on with these significant distancing measures.
Thank you very much, Dr. Mackie. And a follow-up question for you from Dan Brown. And when we publish it, you'll see there's a first part that we're going to remove because you just answered that. Dr. Mackie, can you also give us an update on the number of tests and risk assessments completed at retirement homes and long-term care facilities in London and Middlesex?
Yeah, I don't have the exact number at this point, but it would be in the thousands. There are about 5,000 people living in retirement homes and long-term care homes in this area. And we've already tested half of the long-term care homes. That's on top of any testing we would have done related to outbreaks. So it's probably in the range between 2,000 and 3,000 tests that have been done in that setting at this point, but I don't have a definitive number right now.
Okay, and Dr. Mackie, there was the question also there about the risk assessments that were being conducted in those facilities.
Yes, so update on the number of tests and risk assessments completed. So we're essentially done the risk assessments for those long-term care homes. From what I understand, there are one or two where we're still chasing down some data, but that has been a really helpful input on top of the screening that has already been mandated from the provincial level. And the goal there was to, rather than just waiting for the squeaky wheel to start squeaking, was to reach out to those homes where things might be a bit tenuous, although they haven't hit the breaking point, and try to provide that support to those homes before they hit the breaking point. And so the risk assessments have been great for that, but also the crucial support from the hospitals, as well as the home and community care sector, so what used to be called the CCACs and is now run by the LHINs. Those partners have been fantastic in terms of providing HR support, providing infection prevention control support, and all sorts of assistance, as well as leadership to make sure that homes and the staff that are working in the homes feel very well supported and like they've got somebody that has their back.
All right, thank you very much, Dr. Mackie, and thank you to Mayor Holder. Gentlemen, we're out of questions already today here on our virtual media briefing. So and as I say the words, they come in right at the last second. This is a question for Dr. Mackie. Dr. Mackie, the Premier just announced garden centers and car dealerships will be able to open with certain conditions as of May 4th. Are you confident with starting to open up in Ontario again? And that's from Steve Young at CTV London.
Yeah, thanks for the question, Steve. I've actually been involved in some of the provincial work, setting the next steps policy, giving government scientific advice. The advice has really been, and the government has been listening, it's about businesses if they can open in a way that allows people to respect appropriate physical distancing measures. If a business is unable to open, even if they're in the category of businesses that could potentially be open, that is something that we will be watching very closely. I know other enforcement agencies will as well. And so what I think you're seeing here is the provincial recognition that it is possible to run some of these businesses in a way that very much does respect physical distancing rules. But again, the onus is on those businesses to make sure that they are following appropriate protocols to keep people safe as well.
I'd like to add to that, Dan, if I can.
Absolutely.
This may inform Steve's question a bit more, and Dr. Mackie is quite correct. What the Premier announced today certainly is that garden centers and nurseries are open, but specifically with curbside pickup and delivery only. They've also indicated that lawn care and landscaping is will be open as of Monday. They've indicated also that automatic and self-serve car washes will now be open. auto dealerships, but by appointment. And golf courses can prepare their courses for the upcoming season, so that's optimistic for golfers, but not open to the public as yet. And finally, for those who do boating, I'm not sure that we boat along the Thames particularly, but marinas are going to be able to begin preparations for the recreational boating season, servicing their boats and other watercraft, and even place those boats in the water, but again, not yet open to the public.
Yeah, I might even just add for fun, I posted on social media recently a question about what people felt should be the next sites that are opened up, not necessarily tomorrow. And we're not talking about which would be the most fun to open up again, but which would be appropriate to be some of the earlier facilities that opened up. Parks and trails were a runaway winner, and I think that's absolutely appropriate given that these are places where the more we open them up, the easier it is for people actually to social distance and keep their safe distance. Drive-in movie theaters was a surprise second in this poll. Something that I actually have to admit that I've never been to before, but I'm looking forward to checking out at some point this summer. The winner of the write-in answers in the other category was definitely golf courses. Lots of people saying that they feel that they could golf pretty safely right now and maintain distancing measures.
All right, thank you both for those answers. The next question is from Kerry Mackie at CBC London. Dr. Mackie, is there an update on the grocery store case on Oxford Street East?
Yes. So we've been keeping our website up to date on that question. The grocery store case, again, this was an individual that was preparing bread, both baking and using the slicing machine at Superstore Oxford and Gamage. And the individual was working with symptoms during the April 25th and April 26th dates. So anyone with bread that was prepared in-house at Superstore in that period should be discarding that bread and monitoring themselves for any symptoms of coronavirus. Again, the risk to the public is very low in those situations, but it isn't zero, and so we're asking people to take some relatively reasonable measures to protect themselves. I actually had 2 loaves of bread in my cupboard from that Superstore. One of them was produced locally, and so I had to dispose of that. But additionally, the only other thing that I can clarify from yesterday is that there was one individual at that store who was considered a close contact of the individual who was sick. Other than that, there were no other employees who were close contacts and no close contact with customers of the store.
All right. Thank you, Dr. Mackie. Another question coming in, this one from Mike Stubbs at Global News Radio AM 980 CFPL and Mayor Holder. This one is for you. With the recent cancellation of London's 3 largest festivals, when do you think we'll know about the remainder of the summer festival season? And a follow-up question, with the Premier indicating that large gatherings will be the last to open in the plan that he outlined earlier this week, is there a timeline in place for when Budweiser Gardens may begin operations or the Western Fair?
Well, thanks very much, Mike, for that question. The issue really is about crowds, and right now the current emergency legislation set by the province is crowds of no more than 5, so that's not a big crowd. And even with the group of 5, we are still reminding people that it's critical that they physically self-distance. So at this point, I'm not particularly optimistic that festivals and events will be able to be carried on through the summer. Having said that, I think the paramount issue is the safety of Londoners. And so we will look to that. I will take direction as well from the Medical Officer of Health. But right now, the overarching legislation that prevents these festivals and events from taking place resides with the province. So at this point, those festivals and events that have chosen not yet to make a determination are hopeful. And if they're able to do that, then that will be what it is. But we also know that the larger events take a lot of advanced planning. They take a number of contracts that are put in place, certainly permits from the city. But I think the biggest issue right now is that we have the overarching legislation of the province dictating the terms, and they've been very, very clear. So until that is opened up at all, that's the first test. The second test is, from a London standpoint, whether we feel that's safely in the interests of Londoners.
All right. Thank you very much, Mayor Holder. Dan Brown has another question. This is for both of you. And we've talked a little bit about the announcement that the Premier made earlier this afternoon about some businesses that can comply with physical distancing being able to open on Monday. Dan is asking whether either of you, both of you, I'm thinking, have a reaction to the Premier's plan to reopen the province. Is Premier Ford on the right track? Dr. Mackie, why don't we start with you, and then we'll go to Mayor Holder.
Sure thing. Well, what I think is appropriate about the plan is that it is principle-based. So this is something where each decision will be considered on its merits, and scientific evidence will be one of the main criteria on which the decisions are made. I think having a principle-based approach really helps to for the public and for the businesses to understand why things are opening in one place or another and why they may not. So I think in that sense, we're absolutely on the right track. And you know, there will always be questions about the specific details, and we'll have to see how the plan is implemented. But right now, the principles look really good, and I think that they will serve us well.
All right, Mayor Holder, is the Premier on the right track?
I think the Premier has been quite prudent in terms of how he's approached the managing of our return to what I call the new normal. What he declared just a few days ago was the intention to bring Ontario's economy back over 3 stages. I think what you've heard in terms of his announcement is part of that first stage, where as long as proper and safe physical distancing can take place, then in fact that's the approach that I believe is the right way to do this. We know some provinces have been quicker to do that, but I think that's a function of the medical circumstances in the provinces that are impacted by their decisions, and that relates to numbers of COVID diagnoses, and I think that what we're seeing right now is a very staged, careful approach. I think Londoners understand it. I think they're tired of it, but I think they understand it, and we appreciate certainly our own citizens' response to what I think is a measured way that we can get us back to a proper recovery that much more quickly. And I think that's the key point here, is that the more that people adhere to the direction that they've been provided in terms of safe activities, then the sooner we'll get back to full economic recovery.
Thank you very much, both of you, for those responses. All right, going once, going twice, 3 times. The question well is empty, gentlemen. We are done for today. This will conclude today's virtual media briefing. We'll be back on Monday, and that will be May the 4th. So we'll see you then. Have a great weekend, and till next time, we'll see you Monday.